All right, the time being 9 o'clock on Wednesday, March 17th, 2021. Happy St. Patrick's Day, everyone. I'd like to call this meeting of the Public Health Committee to order. My name is Jared Sanchez. I am the committee chair. Clerk, could you please call the roll?
Silva? Lewis? Shepro?
Shepro present.
Strathman?
Strathman present.
Deppie?
Deppie here.
Weber?
Weber present.
Sanchez?
We have a quorum. Could I please have a motion and a second to approve the minutes for February 17th, 2021?
Deppie moves.
Shepro second.
Shepro seconds. Any questions, comments, additions, or deletions? Hearing and seeing none, clerk, could you please call the roll?
Lewis? Shepro?
Yes.
Strathman?
Shepro, yes.
Thank you.
Strathman, yes.
Deppie?
Yes.
Weber?
Weber,
Sanchez?
yes.
Thank you.
Okay. Next, we have finance and budget. Anyone have any questions about this month's finance report for the health department? Okay, we will move on to public comments on agenda items. I see no one here. We have no one online. So we will move on to animal control. Brett?
Good morning, everybody. How are you today?
Good, how you doing?
Very good. Animal control is doing very well. We just finished our floors, so we're very excited that our kennel has all new flooring, and it has a very good grip on it, so that should lessen some of the slips and falls, and safety for the animal and staff always has to be number one, of course. We're now working on doing some paint throughout the building to coincide with our floors to make everything look nicer, because that's always our goal. And as you can see, revenue continues to exceed expenses, which again is also our goal to ensure we are never a burden on the county. We want to ensure that we always have that ability to be self-sufficient at that time. We do have our first round of vaccine clinics scheduled. We're very excited about this. We moved 2 of our Wednesdays to Saturday clinics. So we're going to start off April 24th. At 10 a.m. Will be our first clinic of the year. It's going to be a Saturday. It's one of the ones we transfer to a Saturday. We do 2 vets on the Saturday, so we're very excited about this. So our first round of dates, we've already had tons of phone calls. We've already gotten it out to a lot of the senior community. So I know everybody's very excited about this because drive-through style makes it very easy that people don't have to leave their car, continues to keep the distancing very safe. And again, that's our goal with everything, is keeping safety first and making sure everybody's taken care of and the animals in this county have what they need. If anybody has questions, please let me know. I'm always here and always available for you.
You know.
Anyone have any questions for Brett in animal control? Okay, thanks, Brett. Appreciate it.
Thank you.
Okay, next, we have the Executive Director's Report, update on COVID-19. I don't think there's anything to update on, is there? Kathy, you want to take over?
Yeah, so we have a few things, and I believe Michael is on and can brief you. So thank you.
Great. Good morning, everyone. Happy St. Patrick's Day to you all. Blair, am I able to get control to share my screen? Yes, thank you. All right, I'll just quickly work through a couple of slides just to give everyone an update of where we are right now. There's a lot of exciting things happening, so there'll be a lot more information over the next few days. But just looking at where we are with a couple of the measures that we keep our eye on. Number 1, test positivity. So out of every 100 tests, how many are coming back positive? We're still hovering a little below 4%, which is very good. As you look at this chart, you can see over the last 30 days, we have had several days where we've had increases, but we've stayed relatively consistent. We're a little below where we started the month. So overall, pretty good. Of course, as public health people, it's our job to worry about things that may be a threat in the future. So with spring break and travel, that's something that we're very aware of. And we're also aware as we get more people vaccinated, which is fantastic news, we still want people to be safe and we still want people to be following precautions. On the next slide, we look at hospitalizations. This also continues to look pretty good. Over the last 30 days, we've only had 4 days where we've seen increases. So that's good compared to the start of the month. We're significantly lower than we were. So it's fantastic news to have less of our residents in hospitals. Again, as a reminder that the previous slide and this slide are both reflecting data for Kane and DuPage counties. This slide is looking specifically at Kane County and the number of our residents that we have lost to COVID. So we continue to lose an average of just over one person per day to COVID. So that continues to be very concerning, but we are doing much better than we were. We're down lower than we've been for several months. So we're continuing to see improvement in that area. And of course, this is the most important measure that we look at. The most exciting news, I think, is the vaccine rollout. So we're seeing a lot of activity here. As of today's data, excuse me, we will go over 150,000 doses administered to Kane County residents. So you can see on the chart on the left side of the screen, this is representing the data that was reported by the state yesterday around noon, 149,000 doses administered to Kane County residents. I think the most exciting thing about this, and you can kind of see it when you look at our trend line here, it was just under 2 weeks ago that we celebrated, let's see, on March 5th, we celebrated that we had passed 100,000 doses. So in less than 2 weeks, we've almost done 50,000 additional doses, or a third of the doses. So you can see the pace of vaccine is really picking up in the community. So that's fantastic. Almost 52,000 of our residents are fully vaccinated. So this means they've either had 2 doses of Moderna or Pfizer vaccine, or we're thrilled that we're starting to see some Johnson & Johnson vaccine, the Janssen vaccine, that's showing up in our community. So the health department hasn't received that yet, but I know some of our pharmacies have been administering it because that's a 1-dose vaccine. That's going to help these numbers move up even more quickly. And then you can see out of our 534,000 residents, 9.73% of them have been vaccinated. That number, of course, includes everyone. So babies and grade school children who are not yet eligible for vaccine. So in terms of our target right now for people 16 and over, that's a population of just over about 420,000. We're doing much better than the 9%, which is great.
Michael?
Yes. Yeah. Hi, Brian.
Do these numbers include vaccine regardless of where it comes from? Okay.
Absolutely correct. So if a Kane County resident flies out to California and gets a shot, and we find out about it in our state registry, that would show up. More likely, it would show up if it's administered somewhere in Illinois. And we do know that we have residents in the Chicagoland area where we are administering vaccine to non-Kane residents who may work in Kane County, and vice versa. I know Kane County residents are getting their vaccines in other places as well, but that's an excellent question. Thank you. Just a quick note on eligibility. So this is a slide we've been looking at for months. So this is well over 100,000 people. I'll just draw your attention again to the very bottom of the slide. This phase B1 plus that includes underlying health conditions, including smoking, obesity, and pregnancy. That dramatically increases the number of people who are eligible for vaccine right now. So it's good that we're protecting more people, but it does put a lot more demand on. And even though vaccine supply is increasing around the county, we're still seeing a situation where we have much higher demand than we have supply, but that's getting better every day. And I did just want to show one quick video. Actually, I'm going to stop sharing and start sharing again because I don't think I shared my sound. So give me 1 second here. Computer sound. Okay, this is a video that we put together, which I think shows people some of the work that's going on. This is a couple snippets from Elgin Community College where we did a clinic for seniors, as well as an event that was hosted by the city of Aurora and VNA Healthcare with vaccine that we supplied for them to provide a special event that they called Black Vax. down in Aurora with African-American faith leaders. But here's an example of some of the new videos we have coming online.
Today we are at a mass vaccination clinic at Elgin Community College in Elgin, Illinois, where we will be vaccinating approximately 3,000 people over the course of 2 days, today and tomorrow.
So important for the African American community to get vaccinated.
I would recommend everyone to come and get it.
And I was very excited about receiving the vaccine.
Very well organized, total of about a half an hour from the time we got up to the door and got our shot, and we're done.
So we want to do more to show the public what's been going on. I can't say enough about our team who's been out there running these clinics. We've held mass clinics around the county in St. Charles and Elgin and North Aurora. Have ministered, and our team just at the health department's administered doses to almost 30,000 people. And the compliments and the praise we get from the public for people who are able to get in and get vaccinated is just overwhelmingly positive. So really for the people here at the health department, they've been doing a great job with that. And our community partners have continued to be fantastic in lending support to us, whether it's schools of nursing, local EMS, local law enforcement, certainly different hospitals who are providing assistance to us. So it's a great community effort. Just a quick note, there's been a lot of conversation about underserved communities. So we just want to emphasize that is something that we're continuing to put a focus on. Madam Chair Pirog has really dedicated a certain percentage of the doses. We want to try to get at least 30% of our doses out to those who are most impacted. So a couple of things we're doing, we're providing vaccine directly to the federally qualified healthcare centers. That's Aunt Martha's, VNA Healthcare, and Greater Elgin Family Care Center. They're some of the largest primary healthcare providers for a lot of our underserved populations. So they've been doing a fantastic job getting people vaccinated. We're continuing to coordinate on-site clinics. So Uche Onwuda from the King County Health Department has been working with the state, and we've been going on-site at meat processing plants and manufacturing plants and really making sure that we can get vaccine to people where they work, especially in businesses where the nature of the work requires people to work closely together. So there's a higher risk of disease transmission. We're continuing to work with our partners to provide more specific spots. So this week, for example, we're doing a Latinx event in Aurora through our partners at the VNA and the city of Aurora. We're providing vaccine to help support that event. There was a little clip of the Black Vax event. We're doing targeted things up in Carpentersville, where we were at a Mexican grocery store a couple of, about 6 weeks ago. So that was excellent. And then there's a clinic that VNA Healthcare is running for people with disabilities coming up. So we want to make sure that everybody is getting access to vaccine. And I think there's a lot of great things in play. And then in the future, we're going to continue to look at these smaller opportunities. We have talked in the past about how we're helping seniors who may not have access to computers. So again, and it's a little small on the screen perhaps, but all of these organizations really led by Age Guide and Senior Service Associates that we've been working with for several months, they are willing to help register people by telephone. So again, this is fantastic seeing the community come together like this. And as more doses and more appointments become available, I think this is going to continue to be even more helpful to assure that all of our residents can get a shot. If people don't know where to call, they can just call 211. 211 has all this information, and they can refer the person to an organization that's close to them. And then this is just some education that we've jointly put together, encouraging people, patience and diligence. It still takes time. Getting appointments at pharmacies is still an option for people if they would like to get one as quickly as possible. Although again, the health department's going to be able to push more and more out more quickly. And then we encourage people to register with us on our website. I'll go quickly over this as well. So register online, English and Spanish, to get weekly updates from the health department. canehealth.com is our website, and we are going to be launching some additional things here shortly, so stay tuned for that. I already mentioned some of the on-site things we're doing. The vaccine supply is going to be increasing pretty dramatically here. It's already increasing for the pharmacies. Direct shipments is going on. Our clinic here, what we're calling Cane Vax Hub in Batavia at the old Sam's Club building, opens on Friday. So there's going to be more information coming out about that soon. But that's going to be really exciting to have a static place where our residents know there's an ongoing clinic. But again, we're going to be making other opportunities available to people. And then I always like to end with a reminder, especially as we build up to having more of our residents vaccinated, just watch your distance, wear your face covering if you're going to be around other people. But all in all, there's a lot of really exciting, positive movement going on.
All right, thank you, Michael. Does anyone have any questions? Mr. Tepe.
Good morning. Thank you, Mr. Chairman. Michael, how will people register for the Cane Vax Clinic?
Yes, so we're going to have a new site that's going to be available very soon, where we have access to the state's scheduling system, which is called EM-Track, and all of the appointments will be available on that site via the link, so we'll be able to share that with people. And then additionally, we're also making the slots available for our senior serving populations or any targeted populations we want, where we can set aside specific spots at each clinic to make sure that we're serving all of our population. So it won't be limited just to people who have access to technology.
But are you talking about having like some of the typical vaccinations sites? You will have slots available that people will go into?
That's correct. Yes, sir.
So,
and we're building that out now. It's based on vaccine supply. So what we're hoping is that we're going to have good news here in the next few days about what we're going to see over the next few weeks. And as we get more and more comfortable with the amount of vaccine that the state is providing to us, we're going to be able to push those appointments out into the future a little bit more. But what we're currently talking about is every week we would update and let the public know how many sites how many spots we're going to have available for the following week.
Yeah, everybody's going to want to know, how do I register? You're opening on Friday. Why can't I register? So
yes, and Friday we have a lot of second doses that we're providing. So especially with the Pfizer and the Moderna vaccine, that's always something to keep in mind, that half of the vaccine that comes in, roughly, we may be needing to provide somebody with their second shot.
Okay. One of the key things I'd been concerned about in the past is the ability for seniors that didn't have computers. So you have 15 organizations now that will accept those phone calls. But very shortly, we're going to be opening up to a newer class of people. How will that be provided? Because it's primarily senior organizations that are doing that now.
Yeah, absolutely. That's a fantastic point. So we have a couple of outreach interventions that are underway, and one I've mentioned in the past, statewide project where locally it's the Illinois Public Health Association that's going to be managing it, and they're calling it a COVID Navigator project, where there's going to be people, probably about 40 people hired in Kane County by 5 or 6 or potentially 7 organizations that will be funded with this grant that's been provided to the Illinois Public Health Association. And these people will be working closely with us, not only helping to coordinate resources as we identify cases who are either positive or people who are being quarantined, so they can help them to coordinate to get the things they need, but also doing outreach in communities. So we're going to have people who look like the people that they're trying to reach out there providing education, encouraging people to take the vaccine, and also giving them information about how they can register.
Okay, and then my last question, okay, is there's been a lot of concern about some of the communities, particularly Carpentersville? Is there going to be a busing situation in some way, shape, or form to help augment the trip down to St. Charles?
Absolutely. So we're working very actively with the school districts, Pace Bus, making sure that there are travel opportunities for people. And additionally, even though we have this fantastic hub that we're going to be creating, we know we also are going to have to be getting vaccine out into the communities as well. So there's going to be multiple ways that people are going to be able to get vaccine. So yeah, great questions. Thank you.
Thanks.
Mr. Kenyon.
Mike Kenyon, I got my second shot last Thursday at noon. I registered it with Sherman Hospital Tuesday. When I walked in there, it didn't even take 5 minutes to go downstairs, get in line, get the shot. It was perfect. Everything's really great at that site.
Excellent.
We need a positive. Everybody's always complaining. How unusual for people to complain, but it's working well up there.
Very good. That's excellent to hear. Thank you.
Yeah, I've heard a lot of good reports of our events, that they run smoothly, nobody's in line for very long, they get in and out, 7 minutes tops. Anyone else have any questions or comments?
Shepro, question.
Shepro, go ahead. Go ahead, Mr. Shepro.
I'm sorry, that connection is unstable. Thank you. Michael, the outreach to the underserved communities, I know that we've noted and you've responded to concerns that transportation, et cetera, initially was not adequate, and I think everybody's jumped on that successfully. Are they subject to the same eligibility standards as everybody else, or how is that working?
I think I lost a little bit of your question there, sir. Sorry, just at the end.
Yeah, I'm just asking if the eligibility standards for underserved areas are the same as for everybody, and it's more a matter of making sure that they have the opportunities available.
Sure. Yeah. And I think the eligibility standards are the same for everyone, but where I think the focus is on the underserved is based on the type of work that they may do. So regardless of where you live, certainly if you're over 65, that's open for everybody. But because of the way the criteria is set up for people working in manufacturing or working in the food or the grocery stores or public transportation, I think that's where those types of jobs make people eligible if they're on a public facing side of that. So that's where we're going to see maybe an increased eligibility in certain groups.
Thank you.
Thank you.
Cheryl, do you have a question? Ms. Strathman?
Yes, thank you, Mr. Chairman. I'd like to ask Mr. Isaacson how people can find out about the bus service.
Sure, absolutely. So those plans for the hub, and we just had a check-in meeting this morning, are just being finalized. So it's something that we want to balance. We don't want every person to just call and ask for a ride. We want to have some type of screening to identify people who really need a ride, so that we can manage the resources that we have. But I think the detailed answer to your question will be made available in the next couple of days.
Okay, thank you very much.
Thank you. I can say, however, that working with these senior serving organizations, we have had fantastic luck with the townships and Ride and Cane and other existing programs where we have been able to get people rides. So for example, at the clinic at Elgin Community College for seniors, we did have a lot of rides that were coordinated, but those were coordinated by the individual organizations. Whereas what we're trying to do now is really expand that to more of a strategic countywide initiative.
Thank you.
Thank you.
Chairman Sanchez?
Mr. Weber, go ahead.
Yes, can you just to clarify, because I've had some people reach out to me, and I've seen some things in the media world in regards to the decision on the Carpentersville location as to why it didn't work out. I would just like to have some good good clarity, so it's on record for people to understand that it wasn't something that us as the county said, we're not putting a facility in Carpentersville. There was more to it than that.
Yeah, may I defer that to you, Chair Sanchez?
Sure. Yeah, there definitely was more to the newspaper articles. They don't always get it right. There were talks with National Guard to coordinate on mass vaccination sites. And Carpentersville, there was a site in Carpentersville that had caught their interest, as well as the Batavia site. And at a meeting last week after county board, they let us know that they were moving in a different direction and that the Carpentersville site wasn't so much on their radar. Talks with the National Guard and coordinating with them are really in flux and very fluid right now. So there are things happening that we just really can't speak on yet because nothing is set in stone. But as far as what are we doing in Carpentersville, I can say that last night, Madam Chair Pirog and myself were at the Carpentersville Village Hall meeting. We got a chance to speak with the village president, the manager beforehand, and we are most definitely working on putting a site together in Carpentersville. It's going to take a little time because we're focused right now on the Batavia site, getting that up and running, working all the kinks out, making sure it's running smoothly. And we were speaking with the village of Carpentersville last night. We're going to work with them and do a little site scouting. Obviously, the Big Lot site was mentioned in the newspaper. That's still a potential site, but there's just nothing certain right now. There's nothing in stone. We don't want to get ahead of ourselves and lead the public to believe something is happening when it could change in the course of an afternoon. But as Madam Chair said last night in public, we are definitely working on putting something up there. So it's not going to be as big as the Batavia site, but it will be something. We also have our mobile vax unit. There are other ideas we are working on to help supplement in the meantime. And so when we have details on all of that, we'll be very public about it and promoting it. So everyone listening knows we are definitely taking care of the north end, and it's going to be good for even the northwest part of the county. People out in Gilbert's and Hampshire, they have a long drive to get to Batavia as well. So having a site in Carpentersville is going to be very beneficial for the entire north end of the county. And so that's where we're at right now.
Thank you, Chairman Sanchez. I appreciate the clarity on that. Thank you.
Anyone else have any questions or comments for this section of the meeting? Okay, Mr. Isaacson, Ms. Foster, thank you very much. Appreciate the update. Okay, we have a resolution authorizing personnel replacement hiring, Kane County Health Department Community Health Specialist 2, Environmental Health Practitioner. Can I get a motion and a second to discuss and potentially pass this resolution?
So moved.
Weber will move. Weber will second. I don't care.
Okay, Tepe moves, Weber seconds. Michael or Kathy, do you guys have anything that you wanted to talk about with this one? It's just kind of a standard business.
Yes, so it's in the head count. It's in the head count of the budget, and it is a health inspector essentially is what it is. So a replacement.
Okay, any questions or comments on this? Seeing and hearing none, clerk, could you please call the roll?
Lewis? Shepro?
Yes, Shepro, yes.
Strathman?
Strathman, yes.
Tepe?
Tepe, yes.
Weber?
Weber, yes.
Silva?
Silva, yes.
Resolution passes. Thank you very much. We have nothing under old business. Could I have a motion to place the reports on file?
So moved.
Mr. Tepe moves.
Shepro, second.
Shepro seconds. Any questions or comments? Clerk, could you please call the roll?
Shepro?
Shepro, yes.
Strathman?
Strathman, yes.
Tepe?
Yes.
Weber?
Weber, yes.
Silva?
Silva, yes.
Sanchez?
Okay, some years ago in a meeting, somebody, it might have been Mr. Kenyon, called for the reports placed on file and said, can we place the reports on fire? And it might have been you or T.R. Smith, and I like that. And every time this comes up, I want to say that, but
Warm the room.
No, Mr. Kenyon needs to move then.
all right, we have no need for executive session. Under new business, we do have a presentation on the contact tracing program. I asked Uche Onwuta to run us through what's been going on with contact tracing. It's been a while since we've heard much about it. So Uche, if you could please take over.
Thank you, Chairman Sanchez. Good morning, everybody. My name is Uche Onwuta, and I'm the Director for Health Protection, which includes communicable disease and environmental health. Next slide. I'll be talking to you about contact tracing, and just want to mention that contact tracing is the bedrock of communicable disease. Essentially, in communicable disease, our goal is to identify those who are at risk and mitigate further spread of the particular disease. So just picture a case of COVID-19 in a nursing home that may not have been reported, and then it balloons into an outbreak of 200 cases, 20 deaths. Some of you might think, wow, but this actually happened. The case was reported, but we had more than 200 cases and several deaths. So this is the reason why we investigate communicable disease to mitigate outbreaks, because one disease turns into several, and then before you know it, there's an outbreak that affects a facility that could cause the closure or more serious circumstances. So that's why we conduct contact tracing. It's not something that's specific to COVID-19. We've been doing this for several years. Next slide, please. So I wanted to start off with letting you know exactly where do we derive our authority to conduct disease investigation and contact tracing. Next slide. So the statute in the Illinois Administrative Code 690 gives us that responsibility. Part of the responsibility of a certified local health department is that a certified local health department shall, in coordination with the IDPH, administer and enforce standards set forth in this subpart, which is communicable disease, to investigate any case or suspected case of a reportable communicable disease or condition, and also to institute control measures such as physical examination, testing, counseling, treatment, vaccination, decontamination, isolation, quarantine, inspection, closure of buildings or facilities. So this statute gives us broad authority to do what we do. And a certified health department shall be responsible for the surveillance and investigation of any dangerous, contagious, or infectious disease that occurs in its jurisdiction. Next slide. Also, a local health department may investigate occurrence of cases, suspect cases, and carriers of reportable diseases, which would be where the contacts will be classified as carriers of reportable disease or unusual disease occurrence in a public or private place. If you remember in 2019, when we investigated vaping, this would be one of those. Because communicable disease investigators are so good with what they do, it's like a detective job, really. We don't just do interview. You have specific skills that is needed for this job, and because of that, we tend to be the communicable disease tends to be the ones that investigate these unusual occurrences of diseases, because we're able to ask the right questions to elicit the certain response that we need. Next slide. So what is contact tracing? It is identifying people who have been exposed to someone with a communicable disease and collecting information about their exposure, essentially, again, is with the goal of mitigating further spread of disease. So we can suggest testing for those contacts and determine whether they have contracted the disease or whether to keep them, because once they've been exposed to disease, they have the length of the incubation period of that disease to come down with the disease or not. So that's why they are observed during quarantine. Some of those diseases have longer incubation periods, like TB, and maybe monitored, and then you have to go back and get retested. And in addition to just observing them, we have to monitor them on a regular basis. Those who have been exposed while during the contact tracing and case investigation. Next slide. So I wanted to give you some examples of areas that we've successfully used contact tracing. In the 20s with syphilis, contact tracing was used, probably one of the earliest reported instances that we used contact tracing. Also with smallpox response, we still use contact tracing with STD and HIV, which is our partner notification program. Obviously, we don't release the information about the case, but it's important that we alert those who have been exposed so that they can get tested. Ebola is another one we monitored in 2014. Several people that went to, even though we didn't have a case, but several people that went to Africa in the areas that were affected, we monitored for 21 days here in Kane County. And then TB, we had an outbreak several years ago of TB. Next slide. So we had one case in 2017 that resulted in 49 cases and over 2,000 contacts. We had to seek out these contacts, promptly test them, and those who were latent TB cases, we treated them so that they didn't end up resulting in full-blown TB. But just one case of TB resulted in 49 cases and 2,500 contacts in Kane County. Next slide. So how do we use contact tracing COVID-19 response? So here in Kane County, because the skills for case investigation and contact tracing are similar, our contact tracers are case investigators as well. So if a case came in, they would interview the case, elicit contacts from the case, and then contact those contacts. And we're required to do that within 24 hours of receiving the case or 24 hours of reporting the contact. This, as you can imagine, requires a large workforce to communicate with this large number of cases and contacts. Right now in Kane County, we have over 51,000 cases, and we have 46,000 contacts. We could have had much more contacts than that, but when we started at the beginning, we were severely short-staffed. In CD, we have one person who handles CD surveillance, and we have one epidemiologist, and then one person who handles STD. So we definitely were short-staffed. And then what we did was we trained all our employees in Kane County, except our finance department, on how to do contact tracing so that we could meet the demand of contact tracing in those early months before we ended up contracting it out to an outside agency. contact tracing requires data management, the technology that we use to track those cases, and ongoing monitoring and assessment. So once we identify the cases and the contacts, we monitor them daily, check their symptoms and their temperature, so that, for somebody who is a contact, they could develop disease within 14 days of exposure. So once they develop disease, we can easily isolate them and prevent them from further spreading the disease to other people. And with contact tracing, we have to communicate with the public, what the guidance is, what is required for schools, what is required for restaurants. It's and this guidance is changed by the minute. Also, one area that people are not very familiar with is the resource coordination part of this. When people are under isolation and quarantine, you can imagine you have to pick up your medication, that you need some food, you need to pay your bills, people are away from work. So there are so many needs for these isolated and quarantined individuals that need to be coordinated by contact tracers. Next slide, please. So just want to give you an idea of the workforce need for contact tracers. This is a workforce estimator that the National Association of City and County Health Officers and the Association of State and Territorial Health Officers put together as is what is needed for contact tracing. Excuse me. On the left side, you can see for King County, the optimum number of contact tracers needed is 457, taking into account our population, our poverty level, percentage of people over 65%, of minority and non-English speaking, as well as our social vulnerability index. Now, what they recommend, the baseline, the lowest you can have for contact tracing would be 15 contact tracers per 100,000, which is what is on the left side. Is if we use just the baseline, we would need 81 contact tracers in King County, as opposed to the 457 on the other side. Either way, we don't even have that many people right now doing contact tracing in King County. Next slide. So what are the steps in contact tracing? So a patient is who has COVID-19 is interviewed, and then the patient is either a confirmed case, which is the person has been tested and is positive, or based on the symptoms they have, we can say that they are a suspect case of COVID-19. And then we ask them certain questions to elicit the contacts who they have exposed. And with those contacts, we contact is triaged for assignment, and then the case is assigned to a contact tracer. The contact is notified by the contact tracer, and then one thing we want to do is test them, to know right away whether they are positive or negative. And usually we recommend 5 to 7 days after exposure for the testing. If they're positive, we quickly isolate them. If they're negative, we still monitor them daily for symptoms and temperature for 14 days. And so that is the follow-up with, sorry, I don't have a follow-up with contact daily. So we self-quarantine, we can test them again to see whether they have turned positive. We assess their medical needs, if they need to go to a doctor right away, or assess their resource need, as I mentioned previously. And then after 14 days and they're still negative with no symptoms, we discontinue self-quarantine. And many times, it could be with a letter to the school or the employer to show that they have completed their quarantine. Next slide. So just to give you a little idea of where we are with contact tracing, right now we have an outside contractor that is handling this contact tracing. We've been doing this since August. So this is we get a daily report on our cases. So on March 15th, we had 66 cases compared to a weekly average of the previous week of 56, and a daily average, a 30-day average of 70. And we were able to contact 76% of our cases within 24 hours and 91% of our cases within 48 hours. We had a total call of 276. This is just the contact tracing calls. It doesn't include our call center. This is just people calling people back, who are cases or contacts, compared to 242 of the previous week. And then the month to date was 3,457 calls. We had 20 tracers active as of that day. And I want to appreciate the Public Health Committee for approving the last resolution for contact tracing. But as you can imagine, it would take us some time to ramp up to the recommended levels. So right now we're at 25 contact tracers, but just for that day, we only had 20. And they made an average of 14 calls per tracer. In terms of the close contacts created for that day, we had 161 close contacts created, and we had an average contacts per case of 2.43. Of those contacts, 91% of them were contacted within 24 hours, and 100% of them were contacted within 48 hours. And in the middle is the breakdown of the cases the last 30 days. As you can see, we had a spike in late February. And then the second chart is the age distribution for those less than 18, and then for those over 18. I like to, on the right-hand side, okay. So people always ask, who talked to the health department? And I can tell you up on top how many interviews we've completed. For the week, we completed 42% of our interviews. And then for the current week, we completed 35% of our contacts. But I love this last table, refused to participate. As you can see, nobody refused to participate for the current week, compared to 3.77% of our cases from the previous week. And then for the contacts, less than 0.6% refused to participate, compared to the previous week of 2.6%. So people are talking to our contact tracers. Somebody had talked about the worst thing is being alone in isolation and you can't even breathe. So the fear of, what's going to happen to me, it's easier when it's somebody else, but when it is you, people really want to talk to us. People want to know what the disease is about. Are they going to survive it? And what can they do so that they don't come back to this situation again, is what we typically see. Next slide. Okay, so just my references, and this is the end of my presentation. Next slide. Thank you. Next slide.
Hey, can you send this presentation out to the county board members, Madam Chair's office?
Sorry, I can't hear you.
Oh, sorry, I thought my mic was on. Can you please send this presentation out to the county board and Madam Chair's office, just so everyone has it that might want to take a look?
Oh, absolutely.
Appreciate that.
Mm-hmm.
Yeah, this is good. We haven't had a report on contact tracing. I get a lot of questions about it, and people think that it's not doing anything and nobody answers our calls. But as one of those last slides showed, almost every single person is answering our calls and being very helpful. Kind of reminds me of the old, like a old fight saying, like everyone has a plan until they get punched in the mouth. And I think with COVID, there's a lot of people that maybe they don't take it as seriously as they do until they get it. And then everything changes for them. And so that's why I think we see those high numbers of responses. So it's very good to see. Our money is being well spent, and we're serving the population as we're required to by law. So anyone have any questions or comments for Uche on this? Okay, excellent. Thank you, Uche, for being here.
Thank you.
All right, public comments on non-agenda items. I don't believe we have anyone for that. I don't have anything to add. I gave my little update on what's happening in the Carpentersville area, at least what are the plans that are being formulated. Does anyone on the committee or otherwise have any questions or comments for this committee at this time? Seeing and hearing none, could I please have a motion and a second to adjourn? Mr. Teppi moves.
Strathman second.
Strathman seconds. All those in favor say aye.
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 Thank you all for being here. And again, happy St. Patrick's Day.